So hi everyone, and welcome to our, I think it's already fourth session of the seminar Philosophy and Psychiatry for 2024. The time for today a bit different. So it is my honor and pleasure to introduce our next guest for today, and this is Dr. Valeria Bizzari. And she is currently working at the Husserl archives at the Catholic University in Leuven, but has also worked at the University of Heidelberg University Hospital for some time. And today, Valeria will talk about a very interesting new idea, new topic that she's working on. Her paper about this kind of a phenomenological interview that has been developed by her for investigating autistic intersubjective experiences or disruptions of intersubjective experiences. And this is the examination of autistic intersubjective experiences type of instrument or interview. So I think she'll talk for about an hour or so, and then we have time for discussion and comments. Valeria, you can go on.
Thanks a lot. Yes, as you mentioned already, first I'm very happy to be here, and I'm extremely happy because I think it's the first time that I share my interview. So it's a very nice moment for me. This is basically the result of my postdoc in Heidelberg, but because of the pandemic and because of the ethical committee's time, we have started to interview people 1 year and a half ago, so when I was already in Leuven. I decided that for my talk, I will focus on the tool, and I will make a quite extensive methodological introduction, but I will not talk about my reading on autism, so maybe this is something that we can reserve for the discussion. Let's see. So basically, the leading question of my research, especially of my research in Heidelberg, is the following. Who is the expert when it comes to understanding people, the detached scientist or the ordinary person in everyday life? So today I will try to answer this question, and I will attempt to figure it out. How can we understand the people who have a particular kind of communication style, namely autistic subjects, whose condition is often described in various ways, including a withdrawal, not just from reality, but more specifically from contact with persons. So basically, my interview has been elaborated exactly in order first to fight this sentence. Autism is not just a withdrawal from reality and from interpersonal contact, but also to explore sociality and its different layers. I would like to do a step back because I think it's also important to figure it out what is a phenomenological interview and how can we use phenomenological interviews in the clinical context. Because I think that this tool itself is already something that can elicit interpersonality. So, as Thomas Hooks argued, the relationship itself between the clinician and the patient can be regarded as a fusion of horizons, a participatory experience in which two embodied subjects resonate with one another, trying to extend the patient's lived space and change her implicit relationship patterns. So we can affirm that the therapeutic relationship is a dialogical intercorporeal space whose primary components are pre-reflective and interaffective elements which converge into something that we can describe as a participatory we subject. And Minkowski has described his with subjectivity very well. I quote from Minkowski, "It was like two melodies being played simultaneously. Although these two melodies are as dissonant as can be, a certain balance becomes established between the notes of one and the other, and let us penetrate a little further into our patient's psyche." So according to Minkowski, a successful patient-clinician interaction must prioritize the full understanding of the meaning behind the lived experience of the patient, which goes beyond the causal origin of the illness. So from his side, the therapist should first familiarize with the concept, a specific concept that is existential stagnation, that is manifest in first instance through the kinesthetic paralysis of the patient's body. And from that, working on creating a dialogue that gives voice to the painful disconnection from the life world. So basically, through the clinician and patient relationship, we can first elicit a social relationship, and secondly, emphasizes the limit of a mere verbal and dialogical approach by including also non-verbal interaction. We will see that, for instance, in my interviews, I will also take into account non-verbal gestures as part of the intersubjective dialogue. The limits of the so-called objectifying gaze that is used in the clinical approach are evident in these reports that I quote. They are mainly from Brampton, who wrote a biography of her depression. She is now describing her meeting, one of her first meetings with her clinician. His expression was neither indifferent nor sympathetic. It was simply clinical. It was as if he was conspiring to be almost entirely anonymous. The anonymity, which is usually conceived as the main important scientific ground, which I suppose he was. I was the focus of our interest, not him. So here, basically, we have a relationship that is quite hierarchical. And more specifically, concerning the diagnostic interview, she said, "We talked for a while, or rather he asked questions and I answered them about my disrupted Lee, my indifferent eating, my disintegrated marriage, my ruinous love affair, my stalled career, about my family, friends, my child, about pleasure, none, pain, too much, and hope entirely absent." It was not a conversation so much as a list of situations and symptoms. So basically, the phenomenological interview wants to fight this kind of approach because there the patient is not an object, firstly, and the relationship is not univocal, is not hierarchical, but there is a reciprocity, because the semi-structured dialogue allows for it and allows for a genuine exchange between two subjectivity. So basically, a qualitative interview is something that puts itself in a different layer of inquiry. This with subject, of course, is a peculiar one, because we know very well that psychopathologies are always basically synonymous with a break of the dialogue and of the relationality which characterize every human being. So this is the reason why it's so important for the therapist to acknowledge the possibility of profound phenomenological differences. And it's what it's going on, for instance, we will see with the ESE, the examination of anomalous self-experiences, and the examination of anomalous word experiences interview, and other important studies that always take the patient's lived experiences into account. We cannot rely usually on the clinical interview because basically it relies on a mere scientific approach and it does not take into account the subject's life world. It depends upon a specific scientific vision that is usually the scientific vision has taken a specific anthropological account. Here, as a philosophers, we know that empathy in the clinical context usually conceived wrongly, is usually conceived as a mere projection, or it is defined in terms of cognitive empathy. This leads to the reification of subjectivity. We also have the problem of interpretation. The language is not interpreted, so we miss the hermeneutical phase. It's an approach that relies on categories. Let's think about the DSM that relies on diagnostic categories, leaving aside the personal narratives or meanings. So, on the contrary, the phenomenological interview, which is a semi-structured interview usually informed by phenomenological concept, allows to grasp the experience of a person as it is actually lived through by her. So an example that I usually make when I teach, one of the first questions is always, which is the difference between psychology and phenomenology. And I usually tend to reply to these questions that while basically psychology remains at the descriptive layer, phenomenology is able to reply to the question, what does it mean to live with a specific kind of experience, a schizophrenic experience, and so on and so forth. So the beneficial of the phenomenological interview is the access that is able to give to the subjective experience of the persons involved in the clinical meeting. And this is important to overcome the mere biological perspective that is usually used in psychiatry in general. These interviews also capture qualitative aspects of the patient's experience. They represent a form of descriptive phenomenology because they are based on reports of subjective experiences, but also a form of categorical phenomenology because they focus on basic structural experiential coordinates. And the aim is to enrich and facilitate the diagnosis. So it's not a diagnostic interview, but it can be used also in the diagnostic phase, and to hypothesize correlations between subjective experiences and neural factors. So, of course, the phenomenological attitude is itself an alternative, but it can be incorporated, embedded in the clinical context. It may also correspond to a sort of structural genetic phenomenology because they seek to identify the key structure of experiences and the underlying disorder in some cases that cause psychopathology. Let's think about schizophrenia. Here also the position of the interviewer is completely different because she makes the patient's life for her own, and it's important to claim here that what happens is an appropriation and not an assimilation. There is always the differentiation between the subjects. The clinicians are able to rediscover the implicit structure of the self and to connect experiences to the transcendental conditions of possibility. So there is a shift of the analysis at the personal layer. So the disorders or the conditions in any case are explained by means of the meanings, feelings, and values that they represent for the subject. We have, of course, the centrality here of what is called implicit knowledge. I quote from Varela, position here is not that of a neutral anthropologist, is rather that of a coach or a midwife. His trade is grounded on a sensitivity about the subtle indices of his interlocutor's phrases, again, bodily language and expressiveness, seeking for more or less explicit indices, which are inroads into the common experiential ground. So it's something that can replace the first-hand knowledge. It's something pre-reflective and pre-inferential. Again, to summarize, the advantages of the phenomenological interview relies on the fact that the patient is not an object, but and the relationship is not univocal. So we have a reciprocity and a second-person perspective. Again, the therapist should acknowledge the possibility of profound phenomenological differences, and the lived experiences of the interviewee are taken into account. Why phenomenological and not simply qualitative? Because phenomenology seeks to find the invariant structures of experiences. So this is important because we don't have a mere descriptive goal. We don't have introspection, so it's basically completely different from psychoanalysis, but it aimed at grasping the invariant subjective structure. This is very helpful because we can have something to rely on, especially when we interview subjects. Phenomenology also allows to observe how this structure of subjectivity, which are basically the body, time, space, relationality, always change in presence of a peculiar condition like a psychopathology. Of course, a phenomenological interview also involves phenomenological elements like the epoche. Is very important and is very difficult but feasible. Both interviewer and interviewee must get rid of prior knowledge and prejudices and focusing only on the relationship and on the experience at stake. For instance, when I started, one of the very first interviews I made, I was in Italy, and it was an interview within the context of a music therapy lab. And together with my colleague, we did participate at the music therapy lab for 1 year. So we basically did play music together with the patients. We basically told them that we were musicians. And at the end, we interviewed them. So in this way, we didn't tell them that we were philosophers, and we didn't talk about, of course, our research and so on and so forth. And the same did happen also for the other interviews. Now in Heidelberg, we just ask person with a diagnosis of autism if they want to participate in this survey without explaining anything. And of course, when the interview is done, if they have some curiosity, they can ask us, but we tend to not to say anything to them. It's more difficult from the side of the interviewer to get to do the epoche because, of course, for instance, I'm interested in embodiment, and I am always inclined to give priority to, I don't know, non-verbal gestures and so on and so forth. So it's very difficult. But for this, there is also the hermeneutic phase that can be helpful. We will see. Of course, other phenomenological elements are those invariant structures that we aim at finding. Subjectivity is not reduced to objectivity, and we have the importance of ambiguity and embodiment. Ambiguity is from Merleau-Ponty, and basically it's the fact that we cannot have a clear knowledge of everything, but we also need to rely on the atmospheric knowledge and the non-verbal gestures. How? There are two main moments, the interactive moments, so when the interview takes place. So here we have the description of lived experiences, basically, because the questions are aimed at eliciting description of personal experiences. And then this description in a second moment are analyzed. So we have the hermeneutical phase. And these two moments should be taught as an epistemological continuity, basically. What about validity? This is a question that I did anticipate, because usually it's something that creates some concerns, especially among clinicians, because if you don't have a quantitative test, how can you validate it? So here we need, of course, an interpretative framework. So we are already in a very dangerous field. We cannot and we don't want to measure the answers. We need to interpret them. This means that it can also happen that a whole interview is conceived completely useless, because it says nothing, because, and this happens usually, I mean, more often with the schizophrenic patients. It can also happen that one patient in this specific day was under medication, and also the dialogue was very slow and unreliable, basically. So it's up to the interpretative framework. And as Varela again underlined, every examination is an interpretation, and as such reveals and hides at the same time. So we don't have description of a statistical data, but experiences. And this means that experiences are subject to interpretation. Petit-Mangean tried to elaborate the concept of phenomenological consistency by claiming for an internal and external consistency, which we have to look in the second phase when we examine the data. The internal consistency means that the description must be comprehensible. Again, as I said, in case of schizophrenic patients, it can also happen that we don't have a comprehensible material. From an external perspective, the description should fit within the already existing theoretical debate. So we have an intersubjective validation. This is, of course, flexible in the sense that, for instance, my interview is aimed at exploring the different layers of sociality. So in the interpretation phase, together with my colleagues, because again, it's very important for the scientific goal of the interview, that I'm not the only one to interpret data, but I interpret them together with other colleagues, in this case, Thomas Fuchs and another psychiatry. So we can also compare our ideas. And in this case, for instance, we always take into account the contemporary debate about sociality, and both scientific and philosophical. And for the analysis approach, I use qualitative thematic analysis. That is a very easy approach that is used also in social sciences. Basically, this approach looks for themes, so something that captures something important about the data in relation to the research questions, and represents some level or pattern of the response. So there are recurrent themes, basically. And this is very important, especially if we compare this kind of interviews to the clinical interviews. We don't matter about the number of the responders. In the clinical scientific environment, in order to have a reliable and something that you can publish, basically, and a reliable result, you need to have at least 100 subjects. In this case, we rely on information power, which means we rely on the quality of the dialogue and the relevance of the participants to the focus of the study, especially because these interviews are very long. They can last, I don't know, from half an hour to 1.5 hours. So it would be impossible to interview hundreds subjects. So at the moment, I think that in 1 year we did interview 20 subjects, something like this. And basically my interview is in continuity, or in any case has been inspired by other semi-structured phenomenological interviews, which are the ISE and the IWI. The ISE aims at exploring experiential or subjective anomalies that can be conceived of as disorder of the minimal or basic self. Again, also in this case, we don't have a diagnostic tool, but is directed especially at the analysis of the pre-psychotic stage. And we have domains specifically committed at the analysis of specific features of selfhood, so cognition, stream of consciousness, self-awareness and presence, bodily experiences, transitivism, and existential orientation. The IWE is the same, basically, but the focus is the experiences that the subject entertains with the world. Again, this instrument explores 6-dimensional subjectivity, so the experience of space and objects. So we have the chiasmatic intertwining between the subject and the world, time and events, other people, language, atmospheres, and the existential orientation, such as attitudes and values. Basically, my interview aimed at examining the relationship between the subject and the others only. And is directed at the analysis of these kind of experiences in person with a diagnosis of autism. So we move from psychopathology to neurodivergence, basically. It's very interesting because when I did start it, I noticed that there are already some interviews. We have the multifaceted empathy test, the basic empathy scale, the reading the mind in the eyes test, but they all refer exclusively to face-to-face interaction. So according to this test, basically empathy and sociality only refers to face-to-face meetings. So they do not take into account other layers like collective intentionality, group-based emotions, and so on and so forth. And they are all quantitative tests. The one that, in my view, is a little bit crazy is the reading the mind in the eyes test. It's very difficult because basically you need to recognize others' emotion only by relying on the eyes like this. So you need to guess if the eyes are expressing joy, sadness. It's very difficult. So I decided to elaborate the examination of autistic intersubjective experiences. Very briefly, I will show you the main domains. We have social interactions. So here we have, of course, the recognition of emotional expressions, but also other kind of interactions, such as that can be different from neurotypical interactions, such as excessive attachment, the so-called social butterfly behavior. That means that you have many friends but only on the periphery, the ability to understand others' mental states, that is the focus of Baron Cohen's theory, social withdrawal, and so on and so forth. Then communication and language, because language itself is a kind of sociality. And for instance, here we have already noticed that autistic persons have a lot of difficulties with metaphoric language and with the so-called affective language. Maybe we can go deeper into this later. Emotions in general. So we have emotion recognition, again, empathy, so the ability to understand others' emotion, trust or mistrust in others, and relationship with peers, characterized usually by loyalty and reliability. Then the focus on embodiment, which is one of the main important domain, because it's related, of course, to the others. For instance, also so both trust and empathy involves somehow embodiment and a good self-embodied awareness. So we have body awareness, intercorporeality, and how the subject handle with physical distance. Of course, we need to take into account shared emotions. So we enlarge intersubjectivity from empathy and face-to-face meetings to emotional sharing, which involves experiences that the subject can only have in virtue of the reciprocal relation to each other. For instance, friendship, or there is a very, sorry, okay, a very important example provided by Scheller, who talks about the grief of two parents who lost their child. So in this case, we have only one grief shared by two subjects. Then we have, of course, contagion, joint attention, collective emotion, group-based emotions, feeling of exclusion and partnership. Social emotions such as shame and pride. So I'm shame of myself, but I can also be shame of myself as a member of group. Social anxiety and insecurity, and the relationship with other gaze. Common sense, so basically the ability to stay in a social context, which involves a lot of implicit rules. Time and motor skills. Ability of synchronizing between internal and external time, ability to organize time, ritualistic behavior, bodily alignments, interpersonal coordination, that is the ability to coordinate with others' actions, which involves mutual predictability. So in this case, individuals share a goal and program their actions in order to achieve it. And imitations. We have different, basically, kinds of abilities that are distributed into different layers of sociality. And they are also all related to one another. Then we have the perceptual layer. When I am in a social situation, I may be sensitive to tactile stimuli, acoustic stimuli, or visual stimuli, or I also can be hyposensitive to them. And social imagination, the ability to imagine myself in social situations. This is very important. For instance, if we take into account online games, and it's very interesting to see how, for instance, the so-called high functioning autistic subjects are very good in participating in group-based activity, which involves the so-called virtual other. So here it seems that the main difficulty lies on intercorporeality, so on the synchronization between different corporealities. We have also social imagination, for instance, having imaginary friends, and the ability to identify with fictional characters. In the interview, I wanted to have a gender balance, basically, interviewed sample. I can already tell that it's extremely difficult. I did not achieve this goal actually at the moment because it's extremely difficult to find girls with a diagnosis of autism. But it's my aim to have a gender balanced interview. Basically, usually autism has been conceived as a so-called male brain condition, but I think that this theory is not very good actually. First, because especially in neuropsychiatry, sex and gender are used together, and there are no differences between sex and gender effects. But again, especially within the contemporary context, if we take into account the body from a phenomenological perspective, we need to go beyond the gender. So we need to go also beyond the binary concept of gender. And then usually females are statistically underrepresented. And this is probably caused by the fact that autism in girls is often confused with eating disorders. So if there is a shy girl, the first diagnosis is, okay, she has probably some problems that can be included in eating disorders criteria. This, of course, has a lot of painful consequences, especially if we take into account the girl in the education system, because we don't have identification, we don't have an appropriate support, and these result in even more emphasized the social isolation, loneliness, depression, and reduced future opportunities and prognosis. Some questions of the test that I did develop are specifically taught for autistic girl. The one, but for instance, about social butterflies, because social butterfly is usually something that is typical of autistic girls. So they are better in mirroring others, the so-called social echolalia, and they are more successful in creating one special friendship. So while it's easier to grasp autism in male subjects, it seems that there is this camouflage, so-called camouflaging effect in girls. What do we expect from the interview? As I said at the beginning, the therapeutic relationship, or in any case, the meeting with another person has already the advantage of eliciting a social value. So in the case of autism, and here I'm especially talking about the so-called low functioning autism, if the caregivers understand how the subject engages with the other, of course, they become more able to attune with them and communicate with them. Another idea that we had and we would like to do is also to do the same interview to the caregivers, and then to have a sort of open dialogue among the interviewees. Again, I really would like to have a gender balanced interview. I will see if I will manage to interview as more queer and female subject as possible. And of course, the advantage is also to foster communication and differentiate among the different nuances of our intersubjective life. So the interest is not only from the so-called clinical side, but as a philosopher, of course, I am interested in understanding how intersubjectivity really works in real life. So I think I can stop here so we can discuss a little bit. Thanks a lot.
Okay. Thank you, Valeria. That was fascinating, very interesting new instrument. And we open up discussion for questions and comments. Okay, we have first hand from Fair. Go on.
Hello, thank you so much for the presentation. It was a lot of information at the same time. I was really interested in being here today because I'm interested in the field of autism. I'm a psychotherapist and I'm doing philosophy. So my question is related to not necessarily to validity, but the results that you obtain in the interview rely on different paradigmatic explanations. Like in the social interaction bit, we can like have more neuropsychological type of results when you talk about empathy or like visual contact, for example. But at the same time, in other areas of the interview, we can obtain more embodied cognition type of results. So I wanted to ask you, how can we make sense of the whole results within different paradigms?
So basically, we start with a specific definition of empathy, for instance, and collective emotions, shared emotions, which are basically the definitions provided by phenomenology. So this is the main and only theoretical background for what concerns philosophy. Because it's a phenomenological interview. And I forgot to mention that the interviews are recorded. So we also look at the videos. And looking at the videos, we also take into account the non-verbal gestures. It's very difficult, of course. I mean, the problem with this kind of interviews is always that you can question the actual validity, because it's at the moment there is the three of us taking care of this data, and of course if I would share I don't know, the same interview with all of you, you can notice maybe something else. But qualitative thematic analysis in this sense is very helpful, because it allows you to look for specific themes, which are usually the themes that recur in different interviews. So you can have indeed a holistic account of what is going on. Of course, we are only interested in sociality. So if I compare, I don't know, 2 or 3 interviews, I look and if I see that all the interviewees mentioned, I don't know, shame in a specific context, I need to take care of it, and so on and so forth. So qualitative thematic analysis for what concern the concept, phenomenology provide us with the definition of empathy and the other layers of sociality, because it's a phenomenological interview. Concerning the interpretation phase, qualitative thematic analysis is undoubtedly, in my view, not also very quite easy, but reliable, because it's widely used not only for philosophy, but also for social sciences and so on and so forth.
Okay, thank you. Next is Matthew. The one.
Thank you so much. Super interesting. I wanted to, follow up kind of in a similar vein on the question of methodology. You mentioned 3 different kinds of, or the 3 different like variants of phenomenology: descriptive, categorical, and structural genetic. And I'm wondering about how, let's say, like descriptive phenomenology seems like we're dealing with relatively surface manifestations of description. And as we move deeper into like categorical and then structural genetic, I'm wondering if you see a divergence between like what is represented in the theory. So if we're reading like structural genetic phenomenology, and then the patient reports, and like a kind of a like the gap widening, like the interpretive gap widening in some ways, in the sense that like patients are using kind of like these are highly theoretical constructions in phenomenology. And so I'm just wondering about how you think about linking something like that developed back to everyday descriptions that you're gathering, if that makes sense. And it's just coming from a personal place where I'm working with schizophrenia patients in a very similar context, and I'm starting to think about like things like genesis, and I'm feeling that the interpretation is taking on a much heavier role than I would like it to in that context, right? So
this is why we need the okay.
Yeah.
No, but I mean, it's basically the problem relies on the gap between the narrative and the experiential self. That is to say, we are looking for subjective structures, okay, that are representative of our lived experiences, but we rely on what the patient or the interviewee tells us. And there is, of course, a gap between what is experienced and what is told. There is already a passage. This is why, firstly, it's also important in my view to take into account non-verbal gesture, because you can, have a comprehensive view, and this is usually also useful to realize if someone is just pleasing you somehow, or things, because it can happen. No? But it can happen, but being qualitative interviews, sometimes it happened to me that they are kind of psychotherapy sessions. I don't know, because once, of course, once a subject accepts to be interviewed, it's quite, it's already reliable in what she says somehow. And we had amazing conversations. And one of them also told me, thank you, because this was helpful in knowing myself better somehow. So we already have some therapeutic somehow effects, but also for myself. But yes, it's this gap between the narrative and the experiential self, of course, exists. I think that phenomenology itself can be helped by this kind of first-person reports, because we can see that these invariant structures actually exist and work behind us somehow. So there is this circularity that you mentioned, but it's not necessarily a negative one in my view.
Yeah, that's kind of what I was wondering, is about the feedback process where the actual data comes to change phenomenology itself, and the circle there. So that's really helpful. It poses questions about what we mean by invariant in some ways, and the depth of invariance in experience. But maybe I'll leave it there. But thank you. It's really interesting.
Oh, thank you.
Okay, thank you both. Do we have any more questions? Okay, Daniel.
Oh, sorry. So I had a pretty short question, I think, but as an autistic person, I was also wondering if you're still looking for interviewees.
Yes.
Would it be possible to sign up for that?
Yes,
Anyway.
but now you know. So
Oh,
it's
yeah, right.
possible,
Yeah.
to do the epoche. It's not
Right,
very,
okay.
not so
Right.
scientific.
All
But
right, all
in
right.
any case, if you wanna email me, maybe we
Yeah.
can
Okay, that would be nice.
discussion somehow.
All right.
Okay, thank you. Chiara.
Hi, thanks for your talk. I'm doing a philosophy PhD on autism, and I'm also a psychotherapist, and I work on the epistemic limits of the concept of autism. And I was wondering if you could say a bit if that came up in the interview. So I was wondering about the role of the term autistic or neurodiverse for your interviewees, and maybe anything that pertains to how their self-narrative or their concept of self changed, maybe perhaps with this term. Yeah.
Yeah, thank you for the question. It's something that I'm thinking a lot about this, because I think that there are a lot of anthropological issues at stake. So for this reason, I have to specify the interviewees at the moment are only German person. And in Germany, the debate, for instance, about neurodivergence is not perceived as strongly as it is perceived in the USA, for instance. Probably if I would have American interviewees, also some answers can be completely different, in my view, and this is my idea. In the case of the interviewees that I got at the moment, I found also with quite a surprise that the autistic label has been helpful for them in order to make sense of a lot of things. In order to make sense of the fact that during high school, for instance, I'm making a real example. During high school, they were not able to understand why I don't get my classmates' jokes while I feel anxiety, and if I have to have dinner with them because I don't know how to improvise, I don't know how to behave. This makes me feel uncomfortable. Then they got the diagnosis and everything made sense suddenly. So they are very happy with the diagnosis actually. So yeah. So in general, the autistic label is something that they do accept quite easily, and it's not something that they feel like, I mean, a restraint. But I think that this is a very wide topic.
Okay, thanks.
Okay, thank you both. Any more questions? If not, I would like to ask one, or is anyone raising their hand? No? No? Okay. So I'll comment a bit. I think this is a great idea, great instrument, a new kind of way to explore what autistic experience is, not to disregard the other instruments or types of research out of autistic experience that is already out there. But as you pointed out very well, this kind of look at the phenomenology is kind of new. I think similar ways of autism studies research was done by Fuchs himself before in this kind of Prisma method that they developed in Heidelberg, which is to engage with the whole kind of interactive experiences, investigation of the interactive experience of intersubjectivity with persons, autistic persons, and non-autistic persons. But this is more of a specific instrument for specific themes that you want to explore. And it also relates a bit to the, I think, at least similar to the research of Sophia Bolzin that we had before on the seminar, and she talked about her methods of this kind of ethnographic and qualitative research into the autistic experience. So one thing that strikes as something that could be added to the instrument at this point, and perhaps would be helpful, would be adding this aspect of materiality, of this kind of experience of the world. Because as you said, you draw your inspiration from the Is and Eve instruments that want to explore the anomalous experiences of the self and the world in schizophrenia. But here we only have this kind of a social disruption, a social experience disruption side or aspect, which is a core aspect, of course, of autism, explored in the instrument or used. But within the teams, perhaps we could add this also theme, the handling of objects, which seems very important in autism. The whole trouble with different kinds of sensitivity to stimuli, as you yourself included this already. But so this whole aspect of relation to the world, which can be, of course, social, other subjects, intersubjectivity, but the material world. And this aspect also seemed to be very important for the diagnosis of autism, for research of what autism is, and even materiality or relation of the subject to objects, material objects in the environment or its ecological niche, so to speak, in more modern terms, which are not phenomenological, from ecological psychology or something, for the affordances around it. Materiality or the objects seem to be very important in mediating the intersubjective relations between autistic persons and non-autistic persons. This is something that has been shown as very important by Sophia Bolson in her research. So she gained better insights or better interaction with autistic people through certain objects. For example, a guitar in musical therapy or something like that, or different kinds of board games that they can comprehend in a more easier way or engage with. So again, I think that this kind of material, so to speak, aspect of the whole socio-material interaction with the world is somehow important and could be perhaps included in one of the team's domains that are explored in instrument. So basically,
Yeah, thanks a lot.
What do you think about it?
Yeah, thanks a lot. I completely agree. And I was thinking that maybe an idea could be to do both my interview, that is very difficult to pronounce, AI, and the IWE. So, I mean, the IWE has been taught for schizophrenic subjects, but I think that everybody can be interviewed with such an interview. So we can incorporate the two, we can use both of them, or it can be added one domain on these aspects. I completely agree. And when I did participate in this music therapy lab, it was a mix. So we had schizophrenic, depressed person, schizoid, super funny, autistic subjects. So all the patients of that specific community participated, and it has been something that has been a benefit for all of them. So these and also it was also interesting to see the material link between the self and the instrument in that specific case. So I feel the instrument as part of myself, as an extension of myself. So it's something that for sure should be taken into account. Yeah.
Okay, thank you.
Thanks a lot.
Do we have any more comments from people here or online? Again, Matthew, yes?
I would ask just a more pointed question about, I thought one of the most interesting things that you mentioned was this idea of social echolalia. And I was wondering if you could just say anything, if you have any insights into like the actual phenomenology of that experience, which seems like very complex and it's like kind of mixture of perception and action and like the kind of almost the kind of like acting kind of component in that. So I was just wondering if you had any kind of like
yeah, it's curious that it has been observed. It seems that it has been observed only in female subjects. So, but I'm quite critical towards this binary, because I think that in any case, all the literature that we have is basically biased by, you know, the binary conception. By the way, basically it's a compensatory strategy. And phenomenologically, it's very interesting because it makes explicit the fact that we are not closed monads, that we need somehow to compensate even when there is a lack of. So in this case, we imitate, we try to imitate the others, and we pretend to be at ease in a social context. Because we don't know how to do, but we know that we should, and we would like to, especially we would like to. So I think that one recurrent theme is the pain side. So the fact that I really would like to, I don't know, understand immediately my peers' jokes, especially in teenagers, you can imagine. But I don't know how, but I would like, you know. So it's something that phenomenologically it's makes evident the fact that we are relational indeed, but in different ways. So,
yeah, super interesting. Thank you.
thanks a lot.
As I recall, there are some examples of this social echolalia in, for example, Donna Williams in her famous autobiographies. She gives a couple of examples from her life and her experience about this kind of imitation of others and in social context. Okay, any other comments or questions? If not, then let us thank Valeria again for this fascinating, excellent
Thanks a lot for the invitation.
presentation. This is very exciting, very interesting, and I hope that we'll see you again here at the seminar with another, and hopefully see the paper on this very soon.
Yeah, me too. Thanks a lot.
It was also very helpful for you, I don't know, for
Yeah. Thanks immensely for the invitation and for the comments. It has been a great discussion for me.
Thanks everyone for joining us today, and again, hope to see you some other time. The next session is next week, actually not the same time, but in 7 days. Okay, so see you everyone. Bye.
Bye.